Caring for a responsive choking adult or child consists of 5 back blows followed by 5 abdominal thrusts. Watch as Richard and I demonstrate this care for a choking adult. To perform back blows, first position yourself to the side and slightly behind the choking person. Then place one arm diagonally across the person's chest and bend them at the waist so that their upper body is as parallel to the ground as possible, like this. This position helps remove the object and allows you to brace yourself if the person becomes unresponsive. At this point, firmly strike the person between the shoulder blades with the heel of your hand. Now, I'll simulate 5 back blows, but I will not use full force as I would if Richard were actually choking. 1, 2, 3, 4, 5. After back blows, if they are unable to call for speak, give abdominal thrusts. First, find the person's navel with 2 fingers. Then, move behind the person and place your front foot between the person's feet with your knees slightly bent to provide balance and stability, like this. Next, with your other hand, make a fist and place your thumb side against the person's stomach right above your fingers. Finally, take your first hand and cover your fist with that hand. Then pull inward and upward to give an abdominal thrust. Now, I'll simulate 5 abdominal thrusts. Again, I'm not going to use full force. 1, 2, 3, 4, 5. Continue giving sets of 5 back blows and 5 abdominal thrusts until the person can call for speak or the person becomes unresponsive. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. The technique for a choking child is similar to that of an adult with slight modifications. As always, when caring for a child, be sure to obtain consent from a parent or guardian before providing care. Of course, if they are not available, consent is implied. Oswin is going to help me demonstrate this skill. Ready? You might need to kneel behind the child to provide effective back blows and abdominal thrusts. Here's how you care for a choking child. Remember, I will only simulate the skill. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Good job. If a person is pregnant, too large for you to stand behind and reach around, or if the person is in a wheelchair, you may need to give chest thrusts. Ready, Marla?
Yes.
To give chest thrusts for a responsive person, make a fist with one hand and place the thumb side of your fist in the center of the person's chest. Grab your fist with the other hand and give quick thrusts into the chest. 1, 2, 3, 4, 5. It is important to know that back blows, abdominal thrusts, and chest thrusts are all equally effective for responsive choking, but it may take more than one technique to clear the airway.
3, 4, 5. If a choking person becomes unresponsive while you're providing care, carefully lower them to a firm, flat surface. Then, immediately begin CPR, starting with compressions. Compressions may help to clear the airway by moving the object into the upper airway, where it can be seen and removed. Before attempting ventilations, open the mouth and look for an object. If you see an object, remove it with a finger sweep. But remember, you should never do a finger sweep if you don't see an object, because you might push the object further back. After doing that, attempt 2 ventilations. If the ventilations go in, that is, the chest begins to rise, resume the normal CPR cycle of 30 compressions and 2 ventilations and use of an AED. If the ventilations do not go in, that is, the chest does not begin to rise, then repeat the cycle of giving 30 compressions, checking for an object, performing a finger sweep if an object is seen, and then attempting 2 ventilations. Remember, never attempt more than 2 ventilations during each cycle.